The purpose of this podcast is simple. We want you to get to know your doctor before meeting them in person, because you're making a life-changing decision and time is scarce. The more you can learn about who your doctor is before you meet them, the better that first meeting will be. There's no substitute for an in-person appointment, but we hope this comes close. I'm your host, Eva Shea, and you're listening to Meet the Doctor. Welcome back to Meet the Doctor. My guest today is Dr. Joy Kong. I'm super excited to have her on because she has a very interesting and different background, and I'll let her tell us what that is. Where are you in the world and your specialty, and what are you working on today?
Well, I'm in Los Angeles, in California, so I specialize now in anti-aging and regenerative medicine. I'm basically a stem cell specialist, and that's been transformed from a psychiatrist. So I was an ex-psychiatrist, but before that, I was studying architecture. So I have, different permutations in life, and I'm not done yet. I'm still transforming, but now I specialize in stem cell therapy.
So how did you make the leap from psychiatry to anti-aging?
Okay, so I actually came to this country, to the US, when I was 20 years old. I wanted to study biology. I loved the human body or any, just life form. I think it's just fascinating. Went into medical school, excited about the brain. I didn't go into medical school thinking I was going to become a psychiatrist. You go into medical school thinking you're going to become a regular medical doctor, but I just got really excited about the brain. So I got kind of sidetracked. So I actually practiced psychiatry for 11 years, and it was great. It was fascinating, but I felt we weren't addressing the root causes enough. We're segregating the head from the body, and that is not a wise way to approach the brain. I feel you really need to address everything else that's in the body, and that got me interested in integrative medicine. Something that's a little bit more inclusive rather than focusing on different organs. How about we look at all the organs together, how they affect each other? And that has to do with my upbringing, the fact that I grew up in China, Chinese medicine, there are meridians running through your entire body, the liver, the eyes, everything is connected, right? Your large intestine, all these different organs are connected along different meridians. And it only makes sense for me to look at the body as a system. So when I started going into integrated medicine, partially to help my patients to do better, partially to help myself to be more vibrant, and that's when I encountered stem cell therapy because it's a cutting edge form of medicine. It's not just your run of the mill because your conventional medicine is not going to embrace stem cell therapy because it's too new. Conventional medicine is very conservative. It takes about 20 years for new science to percolate into the regular medical practice. But integrated medicine are ready to jump on any new information. So anti-aging medicine is about slowing down the aging process. You need to look at all these parameters in health, in nutrition, microbiome, hormones, toxicity. You need to look at everything in order to slow down the progression of aging. But regular medicine, conventional medicine, is not looking at any of those. They're fairly myopic because the focus was on drugs. So if it doesn't fit into the drug paradigm, there wasn't much interest.
I imagine when you're in medical school, being raised in another country where that's not how they think, did it sort of drive you nuts? Like, I imagine you even got in trouble. Were you asking questions no one wanted you to ask?
Well, I had some divergent views from some of my classmates, and I remember meeting this very nerdy MD, PhD student, and I mentioned something about being interested in acupuncture. And then he said, well, there's still no evidence that acupuncture actually works. I said, are you serious? Have you looked? Do you actually in our library, there's like reams and reams of papers actually talking about the evidence. Just because you haven't looked doesn't mean that it doesn't exist. And then he changed his tune. He said, well, we don't know how it works. So because we don't know how it works, he said we don't know how. But all these studies were trying to figure out how. The hypocritical part about this whole medical education was that Then Western medicine never criticizes itself for not knowing how, because once it's proven by some studies showing that there's some efficacy, they push it into the market. They're ready to give it to people, collect money, and never mind, we don't know how, because I found out about that during pharmacology class during my second year in med school. I was mad. I said, well, look at the bottom line of trying to understand all these drugs. We talk about the pharmacodynamics and kinetics and all this stuff. We know the molecules and how long they stay in the body and the results of what they did, but we don't know exactly how it works. But they brush over it. They said, well, it works. So accept it and prescribe it when you become a doctor. And that's when I got really upset because I saw the hypocrisy, that there's double standard. For me, from a Chinese culture, is a given. We've all experienced acupuncture. We've all seen our parents, our friends getting benefits, right? Hormone balancing, headaches, or digestive issues. My mom drinking Chinese medicine, basically cured from multiple myeloma when she was in the regular Western medical hospital for 6 months and getting chemotherapy, almost died. So I have firsthand experience seeing what Chinese medicine can do. So you've got to respect the system that actually works. If something actually works, you need to understand why and how and respect it instead of just dismissing it because it has a different philosophy from yours.
While you're treating psychiatry patients, I imagine this was really challenging to see. I mean, were you just bucking against the system the whole time? It doesn't surprise me that you moved on to something else.
Well, psychiatry actually is a very interesting field. And certainly, there's a psychological aspect, right? Understanding the way we are formulating, we have formulated our coping mechanism, our childhood experiences, how that affected us, but also biologically, our brain, how that could misfunction, creating different erroneous messages and ideas and self-belief. So I actually thought it can be quite effective actually as a discipline because I saw it way more effective than neurology because for my love of the brain, I thought about becoming a neurologist, right? Studying the nervous system. But then I realized a neurologist is a pretty depressing profession because people are quite ill. They get a stroke, they have different brain disorders. They come in and you locate exactly where in the brain the problem is. And that's pretty much all you can do. You don't really have a remedy. But when I encountered psychiatry, you can actually give a drug to somebody that's flagrantly psychotic or manic or very, very depressed to the point of suicidal. And you can give them a medication and lift them out of that state within sometimes a day, 2 days. So I thought, oh my God, I'm making a difference. This is cool. We can actually shift the brain. So in that sense, it's very powerful. For emergency situations, for very acute conditions where people are in grave danger for themselves or to other people, or they cannot take care of themselves at all, these medications are a lifesaver. However, they do not address the root cause. They still don't tell you why the people are getting sick and all the different things that you can optimize. We know people who, through holistic medicine, even if they have severe mood disorder, depression, or even psychosis, by doing nutrition the right way, by detoxing their body, you can reverse a lot of the problems. But if you do not address those and you just throw drugs and drugs and drugs, you accumulate all these side effects and the person's sick, right? Person is still sick from all the toxic stuff that's causing the body to be imbalanced. And then on top of it, you're throwing all these drugs with all these side effects. So it's not a good life. It's not a thriving, it's not what me as a doctor really want to see. I want to see people well.
I was a huge fan of the TV show House.
Mm.
And I'm curious, how do you go about identifying what is causing someone to be unwell if they're in this kind of situation? Do you go to their house and look under the kitchen cupboard? Like Dr. House used to send the interns out there, like, look what we found under the kitchen sink.
Yeah, there could be a lot of things that ended up not being looked at for sure. So, of course, we start with, the most common doctors, if they, especially conventional medicine, if they only have 7 minutes per patient. So, what are they going to do? Are they going to talk to you? No, they're going to try to get a blood test and figure something out really quickly. But if you have time, like what we do in the clinic, we spent 45 minutes to an hour with the patient, really understanding where the patient come from and where the problem could be. And then you can address, look under the hood a lot more carefully. You can look at their digestive system, their sleep patterns, their, ability to adapt to stress and their hormone levels. So you get to look at all these factors. Yeah, it's complex. Human life is very complex.
Give me an example. So, like, let's say someone complains that they don't sleep well. What kind of things would you look at for sleep?
Do they have a lot of inflammation going on in the body? Is their brain functioning optimally? Could there be hormone imbalances? That's just that their system is not imbalanced. Could they have vitamin deficiencies, nutritional deficiencies? Is there toxicity? Are you having some kind of? Is there heavy metal involved? Is there organic toxins involved? Are there parasites or infections involved? What's the status of your microbiome, your gut health? So you just start to dig deeper. A lot of times is poor nutrition and underlying inflammation. The ail of modern life, right? We're eating terrible food that's produced for us to be addicted to and to make money. So people are giving us food to make money, not to help us to be healthy. So that could be one of the big part of the problem. And then you're addicted and you keep eating the food that's bad for you and you don't even realize. And then you get all these metabolic problems. So you need to address the terrain. It's a journey. Anybody. I have not met a perfect human being. We're all on a journey, whether or not is psychological or physical or spiritual. None of us is done.
Today, how do people find you and what do they find you for? When someone calls your office, what are they asking for?
Yeah, they usually, most of them, I would say 85 to 90% of them are dealing with a severe health issue, a crisis, and they've tried everything. And they stumble upon me a lot of times on YouTube because I do a lot of education. I do give lectures a lot to doctors, but those lectures are also on YouTube. And I also post videos where I explain things in a more kind of understandable form. I don't care about big words. I want to understand what's the bottom line. What can you tell me that's actually going to make a difference to my health? And that's really what's important. So I do some podcast episodes and I interview various scientists and doctors and pioneers. But I also, as a stem cell specialist, there are so many misconceptions and so much to cover in the area of stem cells. So I keep educating people. And then people find me on YouTube. They usually go down this rabbit hole and watching all of my videos and they find me. But the good thing is by the time they find me, they've almost watched all my videos and they're already educated on the
They
subject.
know everything.
Yeah, which is
Yeah.
fantastic. Then we can really just tailor what we talk about regarding the patient. Instead of asking general questions about stem cell therapy, let's talk about you, how we can help you.
And are they all ages? Are they mostly from California? Are they from all over the world?
We help patients, we used to say 5 years and above, but now we lowered it 4 years and above because there's so many autistic children. So we do have a pediatrician on staff and we treat a lot of little kids with autism, even teenagers or even in our 20s, people with autism, and then all the way to people in their 90s, right, who may be suffering from some condition or who may just want to live better life toward the end of the life. Yeah, the whole gamut. So we see, the entire spectrum.
Tell me more about the autism. I heard on a podcast that I listened to of you talking to someone else earlier today that was the first thing that you sort of fell into
Yes.
backwards with stem cells on was a child with autism.
Right, right. It's funny, me going into psychiatry, I thought, oh my God, all these adults are suffering. Why don't I intervene earlier? So I want to go into child psychiatry so I can stop people from becoming so sick. But the problem with child psychiatry is that there's so many autism patients, is autism, ADHD, that inundated child psychiatry practice. And the depressing part was, I don't think child psychiatry really was that helpful because they are either sedating the patients, the little kids, or they're stimulating the little kids. So there's a two directions, sedate or stimulate. And fundamentally, it's not making them function better. It's making the life of parents just a little easier. That was it. And it's not satisfying. It's actually depressing. So I purposely did not go into child psychiatry, even though I've seen plenty of autism patients. And then I ran into this anesthesiologist who had nothing to do with autism, right? Not educated on autism. And he told me, oh, I just gave this autistic kid some umbilical cord stem cells. Look at all these things that teacher were reporting of all the changes, better eye contact, no longer procrastinating, able to verbalize, able to play better with other kids. The 40 different things, a long list of changes that he was able to to bring about with some simple IV infusion. So I
That
thought,
was my next question was
yeah,
how did he give it to him? How do we even
like,
deliver
you
stem
are an
cells to a
anesthesiologist, but you're able to bring
Yeah,
this kind of results where I was trained in it and I don't have the tools for it. So I better look into what are in these cells. What are the cells doing? What the hell, right? So,
right.
I have all these drugs. I can't do what you just did. So that's really, that was the beginning of just, my curiosity, right? Why? My curiosity is the most important thing. I want to understand. So if something is helping somebody so much, I'm going to do whatever I can to understand it. So that's how I got into this deep dive, looking through all the research of these studies from all around the world, and not just autism, right? Osteoarthritis, autoimmune diseases, brain conditions, heart, lung, liver, kidneys, reproductive system, and you name it. The research is so abundant and so exciting, and that's how I ended up creating an academy where I train other doctors, because by me diving into all this, I'm collecting all this evidence, all these articles. And I thought, I better share. I better teach other doctors since there's no formal education about this.
It sounds like you're sort of obsessed with figuring out how these work.
Yeah, right. It's a good obsession. Right. So I
It
can
is a
present
good
good stuff to the
obsession.
world. Yeah,
Do you
yeah.
have any stories, like success stories, or they don't even have to be like big wow stories, but what kinds of things have you done to help patients with stem cells?
So let me just talk about my very first patient who had knee osteoarthritis, very common condition, 69 years old, told by two orthopedic surgeons, that, oh, absolutely, you need bilateral knee replacement, period. And then he came to me wanting to save his knees, hoping not to get surgery. And what I did was that I gave him an IV infusion and I injected 1 cc of stem cells into each of his knee. And what's fascinating was the next day, first of all, he said, oh, I slept through the night. I haven't slept through the night for 40 years because I have this rotator cuff injury when the car rolled over when I was a teenager. So the injury never fully healed. Every time I shift my body, I end up waking myself up. So he slept through the night. That kind of got calmed down. And this is 8 years later. The shoulder was fixed. I never touched the shoulder. I didn't know about the shoulder. The shoulder was fixed and the knees were fixed, right? Never needed surgery. He's late 70s. He's going to more trade shows than anybody I know, with tremendous stamina and walking everywhere, 4 miles a day, actually. That was just my first taste, right? As a psychiatrist who ventured into integrative medicine and trying out stem cell therapy, that was my first case. It's like, oh my God, I'm able to do what these orthopedic surgeons have no idea about. I saved his knees. I mean, how cool is that, right? That's why I went to medical school, because I wanted to be effective. I wanted to actually make a difference. So that was first one. One patient had liver cirrhosis. He was in deathbed, hospice. So he had big ascites, right? Big swollen belly, very skinny, barely had very weak voice. I could barely hear him. And he was basically close to death in maybe a few months. And then his brother paid for his treatment. And I gave him one treatment. I was expecting him to come back another time, but he didn't come back. So I didn't know what happened to him. And then I got on this radio show. The person that introduced me and the brother was the radio show host. He said, "Hey, I have this patient's brother on the line, and why don't you talk on air?" I was like, "Oh, really? Great. Well, how is your brother doing? The one with the liver cirrhosis?" He said, "He's doing great." During the drive, even just driving back home to Sacramento from Los Angeles, his swelling was going down tremendously in his abdomen. And then within a few weeks, he was walking around, pacing in the yard, talking on the phone like a regular person, right? With loud voice. And then within a few months, he went back to his primary care, found out his liver function was normal. And I literally said, "Really?" I mean, because I was so early. I was still early in my career in stem cell therapy, and that was a shocker. And so that's another example. But yeah, recently we had a 17-year-old boy who had progressive cholangitis, which is a inflammation of the bile duct to the point where his liver was shutting down and he is on the liver transplant list. And after 2 stem cell sessions, his liver function was returned to normal and he's off the liver transplant list. I've treated COPD patient, this 9/11 responder. He has severe lung damage. Half of his colleagues have died, from trying to save people after 9/11. All young, vital men, in their 40s. So he didn't know how long he was going to live. And then he first went to Mexico to get stem cell treatment, but got a lot of side effects and some benefit. But when he came to us, no side effects, tremendous increase in energy. So instead of 2 months of severe fatigue after the stem cell therapy in Mexico, he got no fatigue with increased energy and significant improvement in 3 days of his lung function instead of after 2.5 months after the stem cell therapy in Mexico. That just shows you stem cells are not the same everywhere. You don't just, like stem cells, so it didn't work in one place, doesn't mean that stem cells doesn't work. It may just be that you didn't go to the place that have the right cells or the right techniques. So, but now his lung conditions reversed. His pulmonologist basically said, "Yep, you can say that you don't have lung disease anymore." It's incredible. He's the first 9/11 victim that has a reversal of the lung disease because of 9/11. So I have so many stories. Yeah, testicular swelling, saving somebody's testicle and from it repeated nodules, inflammation, and infections. We recently had somebody who was blind in one eye from surgical injury during a brain surgery when he was 9 years old. So 44 years later, we did one stem cell treatment and he began to see in that one eye. Yeah, just lots of wonderful stories.
I have so many questions. How long did it take you when you started doing this to realize that it was doing what it was doing? I mean, it seems like even now you're sort of like, I can't believe that worked.
I know. I'm constantly inspired by the results. It's like a little kid in the candy stores. Because I have quite a few doctors working at our clinic, and they share with me like, "Oh yeah, this patient, guess what's just happened?" I was like, "Wow, really?" Yeah, we had a trigeminal neuralgia patient. After the fifth COVID booster, she got debilitating trigeminal neuralgia, these nerve pain. It's so severe that she was thinking that she didn't want to live anymore. And then with one treatment, basically she became pain-free. She had one episode 1 week later, that was it. But she was getting 30 to 50 episodes a day. So, I mean, we just keep accumulating these really incredible stories because a lot of it, there's no research. So we're on the front line. We're seeing firsthand what happens to people who suffer from different conditions. And we don't know what's going to happen. We never make claims. We don't overpromise. We just tell the patient, we don't know. This is experimental, but we know how the cells work, right? The cells are anti-inflammatory. They modulate the immune system. They break down scar tissue. They help with new blood vessel formation. They kill off cancer. They protect damaged tissue, preventing them from dying. They give you fresh mitochondria to help your cell elevated cellular energy. So all these things we know of how the cells work. And then let's look at why you're having disease in the first place. Is there a lot of inflammation going on? Is there tissue damage going on? Is your immune system dysregulated that's preventing you from healing? If those are true, then the stem cells, hey, they're anti-inflammatory, immune modulating, and they promote tissue repair, right? Wake up the local stem cells to help you make new tissue. So then we can tell people this is how the cells work, this is how your disease work, and let's see if they're fit. So that's how we approach this.
Does it ever not work?
Yeah, yeah.
Yeah.
I would say our success rate probably is 90%. We definitely, a vast majority of patients will see benefits. But like I said, health is complex.
Yeah.
So even psychologically, if some the people who are very negative, who are kind of almost like a willing themselves, I'm just miserable, nothing's going to help me. So if you have that kind of attitude, it is much more difficult. But that aside, there's a lot of people with toxic load. It could be heavy metal, could be organic toxins, it could be parasites and infections that just harboring in their body. And that is really dragging their regenerative potential down. And even things like infections from root canals. So
Yeah,
have you seen the documentary Root Cause?
I
It's
have.
such a good documentary, so interesting. But it goes into the science and it's entertaining as well. But it shows you what happens when the root canal goes wrong, which a lot of them do go wrong, and how you had a raging toxicity infection right in your head. And that could be preventing things from healing. And then certain viruses also selectively attack the type of stem cells we're giving patients. So, like herpes family virus, they tend to destroy mesenchymal stem cells that we're giving to patients because those cells somehow have the receptors for these viruses. So, the nature sometimes have this strange, the design, the fluke or whatever that's going on. So, there's a lot of factors. That's why some people, if it doesn't work, then that gives us a clue. Okay, there's something deeper, something we have not addressed yet. So let's take a deeper dive into your system.
Where do you get the stem cells from?
The ones we use are from the umbilical cord. So I actually broke down why the umbilical cord source right now, I think, is the most potent and the safest and also ethical at the same time. So no one is using embryonic stem cells, which requires the destruction of an embryo, but the umbilical cord cells comes from a live, healthy birth. So when a baby's born, the baby's live and healthy. What do you do with the cord, right? You cut it off and you toss it
Yeah.
in past. But
I'm very annoyed right now that you didn't tell me to save those.
now
'Cause really feel like I wish I had them back now.
I know, I know. So they started to ask parents if they want to save them. Because it costs a lot of money, a few $1,000s a year. A lot of parents would
Yeah.
just say, "No, it's okay. No, I'm not going to save it." But they're asked if
Are you
they want to
talking
donate.
about when they ask us if they wanna bank our cord blood? Is
Yes,
that what they're
yeah.
Yeah.
So there's
Yeah, and everyone was like, "Nah, don't do it. There's nothing you can really do with it." I remember this wasn't that long ago for me.
it probably can do a lot. It's supposed to be
Yeah.
for your baby, but some parents want to use it for themselves. But if you want to use it for yourself, you might as well use, some other person's umbilical cord. You don't have to use your own baby's. That's supposed to be saved for your own baby. That's identical to your baby. You're only 50% identical to your baby. So you might as well use a stranger's because all these cells from the umbilical cord, especially the cord tissue, they're full of mesenchymal stem cells, which are immune evasive. So they're kind of under the radar of the immune system because they don't have surface markers that mark them as foreign. So it doesn't even matter who it came from. It can be
Right.
from someone completely unrelated, and it doesn't provoke that kind of immune reaction. Actually, it's been FDA approved to treat immune reactions like acute graft versus host disease. So that's something uh, that we now know we can tap into, which is these new birth tissue that usually was tossed. Now we can get all the cells either from the cord blood or the cord tissue, which is mostly the Wharton's jelly. That's a gelatinous material that's wrapping around the blood vessels in the cord. There are a lot of mesenchymal stem cells, so you can get those out. Yeah, highly, highly therapeutic. A lot of great research on them.
That is really exciting. And what a world we're in. It feels like Christmas. Like where did you come from? And I'm just floored and I'm so excited that we got to hear just a little piece of what you're doing today. It's remarkable.
Yeah.
And it really, your passion for it is what makes it so exciting, because I don't think you're going to give up until you have figured it all out. Right.
No, this is fun. This is fun, right?
Mhm.
Life is about thriving. It's about expressing your power, right? You're given this consciousness, this body to explore. And you need to express yourself. And you're expressed by using your intelligence, using your creativity. So that's what I'm doing. I'm using my creativity and intelligence to make the world better, to just everybody, to elevate everybody. It is exciting. And we're just at the beginning. The drug paradigm is dying. I'm sorry. Drugs are important,
It
but
is.
to focus on drugs, it is so narrow minded, it's very immature. It's an immature way of looking at this miracle of a body. There's so much we can do. I mean, we're just getting into just the surface. Now we know about these stem cells. We also know about different organelles, what they can do. Now we know about quantum energy, how they can trigger the cells and program the cells. Like in our clinic, we use laser light to direct the cells to different organs. I don't have to inject into different organs. I can use the light to help attract the cells to different internal organs. So it's like a kid in a candy store. We have so much great stuff happening. Yeah, you just wait, just stay alive, and it's going to get better and
Yeah.
better.
Just hang on. Around the country, now not everyone can come to LA to see you, although now I'm thinking about it now. How would we find someone who is as well educated, or I mean, maybe there isn't anyone, but with as much experience doing this the right way anywhere else in the country? What would we look for?
People who are actually trained and educated on this. So a lot of doctors, unless you really devote the time, like you said, I was obsessed, so I went down a rabbit hole. But not many doctors have the time or the determination to just go down that rabbit hole. So then they can take a course to become familiar, right? So they can sit down and be given the information, at least go through the training instead of searching for everything on their own. So this is why I founded the academy, where when doctors get trained, they get a full spectrum of all the information. And then, and I teach them techniques of how to do the stem cell treatments. So it's called AAICT. So we have some providers listed on the website. If people are not in Los Angeles, they can look for a provider that may be closer to them. So that's one resource. But it's a little bit of a wild west. There are different doctors making different claims. It's very confusing for patients. But really, how do you know who's good?
I mean, the reason I make podcasts with doctors is because I want people to get to know them and make good decisions. And the way I found my lawyer was because she had a podcast. I think that's
Oh,
how you figure it out.
interesting. That's funny.
And you have
Yeah,
a podcast. See what everything has in common. It's that they all have a podcast.
that's funny. Yeah.
That must be it.
Well, I just listening to, I think it was Joe Rogan's show, and they were saying,
Mhm.
don't even count on mainstream media because you're getting a very skewed
It's
view
over.
of the world.
Yeah.
Yeah. So podcasts, real authentic people talking about
Yeah.
current, real subjects instead of filtered and doctored subjects.
Hmm.
Yeah. So that's where the freedom can be found, that you can seek truth. Yeah. Instead of
Yeah.
being told.
And rely on your instincts, because, if something, I think my mom always said, if it seems too good to be true, it's probably too good to be true.
Mhm.
Anyone who's overpromising anything anywhere is probably not being realistic. So,
Mhm.
yeah.
Yeah. Yeah.
Give us your website, your Instagram handle, and your podcast, and I'll make sure we put links to everything in the show notes so that they're easy to find.
Okay, so my website is just Joy Kong MD, so Kong with a K. So joykongmd.com. That has everything that I do, basically my clinic, the stem cell company I created to help the other doctors, the academy I founded, American Academy of Integrative Cell Therapy. So it's aaict.org. The stem cell cream I created, I don't think we talked about it. I created a stem
No,
cell cream.
no, now you have to tell us. Sorry.
It's 100% natural. It's a labor of love because I wanted a decent cream for myself that I know is not toxic. So I created a 100% natural cream that has a stem cell component, have peptides and all these herbal extracts. I probably packed in more herbal extracts than any cream out there, and antioxidants, prebiotics. So it was a really comprehensive, very, very mild formulation, but also very potent. So it's very gentle on the skin. It penetrates deeply, but has powerful components. So that's called Chara Omni. And then I had my memoir, Tiger of Beijing, that talked about how I made it to America when I was 20 years old and how I survived the first 2 years. I ran into another obstacle in this country, this culture. So it's a good story. Of course, my podcast, people are welcome to check out my podcast, Dr. Joy Kong podcast. And my Instagram is just Dr. Joy Kong. Yeah.
Okay.
Dr.
Well,
Joy _
you,
Kong.
now you keep giving me more things to ask about. I guess we'll just have to leave it with a cliffhanger, or you're going to have to come back and tell us what the story of the Tiger of Beijing is.
Oh, the story's a good one. Yeah. Everybody who's ever read the story, and they were very surprised. Yeah. I'm a very candid person. I hold nothing back. What I experienced is what I'll tell you. And just take the journey with me.
I'm not going to get any work done today. Thank you. Thank you, Dr. Kong.
Yeah, this is a fun chat. Thank you, Eva.
If you're considering making an appointment or are on your way to meet this doctor, be sure to let them know you heard them on the Meet the Doctor podcast. Check the show notes for links, including the doctor's website and Instagram, to learn more. Are you a doctor or do you know a doctor who'd like to be on the Meet the Doctor podcast? Book your free recording session at meetthedoctorpodcast.com. Meet the Doctor is made with love in Austin, Texas, and is a production of The Axis, TheAxis.io.